Well, good afternoon, everybody. Thanks so much for joining us for this webinar about tips for effectively using 413Cares. We're so glad that you could make it today. We are excited to be sharing this information with you, and we will be sharing this and the slides with everyone after the webinar. The goal for this webinar is really to provide practical guidance on how to use 413Cares effectively. Many of you have probably used 413Cares before, but we want to make sure that you're able to utilize all the tools and effectively do searches to find what you need. We also hope that we can address common questions we often hear from people who work at our local service providers and community-based organizations. And share some of our best practices in using the platform. It is also the end of Public Health Month here in Springfield. The city of Springfield honors public health throughout the month of April. The first week of April is Public Health Week nationally, and in the city, it recognizes it all month long. And so we're excited to offer this webinar as we close out Public Health Month and recognizing that many of you and lots of other community organizations and people in our communities are working to improve public health and keep our communities safe and healthy. And we're just happy that 413Cares is one tiny piece of that work as well. Next slide. I should quickly introduce myself before I get into housekeeping. So my name is Levana Homstead. I am a senior manager of coalition building at the Public Health Institute of Western Massachusetts, and I manage our 413Cares platform. So really happy to be doing this webinar for you all. Just a couple quick housekeeping tips. We are recording this webinar. It will be shared as well as the materials with everyone after and also posted on our website. We have the chat function open, but encourage anyone to put their questions into the Q&A so that we can try to answer as many questions at the end of our presentation. So we are saving some time for that. We also have some questions that have been submitted with the registration, so we'll be looking at all of those. If you need closed captioning, just click Show Captions, and it should enable the automatically generated closed captioning in Zoom. And at the end of this webinar, we ask that you take about 1 minute, if not less, to take a quick survey to give us feedback on the webinar. So we'll be sharing that link in the chat at the end of this presentation. So with that, I'm going to turn it over to my colleague, Francheska, to kick us off with some overview information on 413Cares.
Yeah, thanks, Luana. Hi, everyone. My name is Francheska Bermudez. I'm the project coordinator for 413Cares. Before we start, I'm going to launch a poll just to see where are we tuning in from, where are we from, and how do we use 413Cares? We're going to have a few seconds as they come in. Almost everyone is answering. Okay. So let's see where everyone is tuning in from and how they use 413Cares. So most people are using 413Cares to search for programs and services and sharing with clients and referring using our referral process for programs. And there's a mix for where people are primarily working from, with Hampden and Berkshire County in the lead, but we have some Franklin representation and Hampshire representation. So awesome. Just sharing it real quick. So before we go into how to use 413Cares and some of our tips, just want to highlight that 413Cares is supported by our advisory board that helps guide us in our continued development. We have 5 regional partners in Western Mass that help strengthen the platform and inform the community in all corners of Western Mass. We're grateful to be funded by Bay State Health and the Massachusetts Department of Public Health. And 413Cares is managed by the Public Health Institute of Western Mass. So for anyone who's joining that may be newer to 413Cares, here's a brief little quick overview. So 413Cares is a community resource database, a resource hub for all counties of Western Mass and beyond. It lists free and low-cost direct social care services on the platform, and it's free to use for both individuals looking for the programs and services, but also organizations that have their services on here. Information is secure, it's high trust certified and FERPA and HIPAA compliant. And really the powerhouse, what powers 413Cares is Find Help. And so Find Help is a national platform that has built an extensive care network of free and reduced cost services nationwide. So really that they are the powerhouse of 413Cares. And so whether you access the database through our 413Cares platform or through Find Help or through another agency that may use Find Help, it all leads to the same services and programs on through it all. So there is no wrong door to access these services and programs. I want to share a quick video of myself. It's a 1-minute explainer video showing how to navigate the platform.
413cares.org is mobile friendly, tablet friendly, computer friendly on all devices. So first type in your zip code. For example, we'll use 01020, a Chicopee zip code to search. The first category on the menu is food, and from there you can go into emergency food, food pantries. Help paying for food is already a specific category on there already. If someone wants to connect with the program, there's always this big teal button on the right side of a program card that will say contact here, apply here, referral. And that is really how you connect with the program, and the program can connect with you. And that can vary. It can be a phone number, you talk to someone immediately, an email, and there you make the connection. So one of the neat features about 413Cares is that you can just translate the whole page that you're looking at into Arabic, Spanish, Swahili. You can translate it, so it's easily accessible for everyone, and that makes all of Western Mass feel a bit connected on this platform.
Great. So I'm going to switch it over to my colleague Lavana that will walk through the tips and best practices for using 413Cares. So looking at the resource pages versus doing a search, how to maximize your search results, the ability to translate the pages, other useful platform features, and going through our referrals. So Lavana, take it away.
Francheska. So I'm excited to get into more of the nitty-gritty of how to effectively get the search results that you might be looking for whatever topic you might need. And I hope I'm going to answer some common questions along the way. So let me share my screen. So if I'm going to go, this is 413cares.org. And there are a couple of things I want to call out on how you can connect to the services that you might be looking for. So there are 2 ways to start to do that. There is what we call our search widget or search box right here on our homepage, where you can put in your zip code and click search to get started. There's also resource pages, and we are constantly adding to this. But in the most recently, I added this page for LGBTQIA+ resources. But these are what we call resource pages, and these are developed out for a few reasons. One, because we know people are most commonly searching for housing, followed by food resources, and also then followed by health, so mental health and behavioral health. We've also developed some of these resource pages in different partnerships with the Alliance for Digital Equity, the Hampden County CHIP, and the Youth Mental Health Coalition. And then other pages have been developed because we've heard that it's a need in the community and we're trying to respond to the needs in our Western Mass communities. So when do you use a resource page and when do you use the search bar? Let me start with resource pages. So the way these resource pages are designed are we create these. So when I say we, I'm talking about Francheska and I and our other staff members here at the Public Health Institute. So we are trying to pull out some of the key resources in these areas. We're not going to be able to put every single mental health resource on this page. We're looking at our mental health resource page right now. So we're going to be pulling out the key areas that we want to lift up the different resources across Western Massachusetts. So it's going to pull in we're pulling in resources from Berkshire, Franklin, Hampden, and Hampshire counties. You can see these are the areas that we've identified resources or information in. And let's say I wanted to learn about counseling. I can click on it. It's going to bring me down to the counseling page. So each resource page is going to have a mix of information about that we think is important to lift up, maybe linking to other hubs of information or other sites that offer some useful information or resources. And we also are going to link to what we call favorites folders. And these are lists of services that we have created in the Find Help platform. So if I want to look for counseling services, I could click here and it's going to open up. I'm going to give it a minute to load. It's going to open up a list that we have created. So we have pulled all these individual programs from across the 4 counties into this favorites folder for mental health counseling. And this is helpful if you don't want to be overwhelmed by going about searching on your own, using that search bar. Some people can feel overwhelmed. Sometimes it feels hard to there's just might be a lot of search results. So the favorites folders are trying to help people feel less overwhelmed and to get them to help them navigate and find the resources that they might be looking for. As I said, a favorites folder is going to have programs across all 4 counties. So you might want to narrow that by the programs in this list that just serve your county. So you could put in, your zip code. So you could put in your zip code. I'm going to use a Springfield zip code right now. And I can filter the list, and that filters out any programs in this list that do not serve my zip code. If you know that there should be a program on this list and you're not seeing it, you can always contact Francheska and I, and we can update the list. So you can let us know. So let's say I've looked through here and it's not exactly what I'm looking for. Maybe I'm looking for something more specific or something different altogether. Maybe I want to actually do my own search. And that's when you want to use our search bar and see what else you might find. Or maybe you wanting to look outside of Western Mass, whatever. So here is where you want to lean into doing the search, starting with your zip code. So I'm going to put in the same zip code. And let's say I wanted something more specific than the more general counseling programs that were listed there. Let's see, maybe I want to look at anger management programs. So I'm gonna use that tag in this. I went through the different mental health care options here, and I chose anger management. So this is where I can start to get into, okay, what are the results that are coming up for anger management that might be what I'm looking for. So the search allows you to go more in depth and move around into what you might be looking for rather than leaning on um, the lists and the favorites folders we've created on our resource pages. But both are great options to be looking for what you need. Just know I want to make sure it's clear because we commonly get this question. The favorites folder is not doing a search. It's going into a list that we have created. So it's not the same thing. So, excuse me, I'm trying to go back to the tab I was in. So I want to now get into how to really maximize your search results, and how to find what you're looking for. So here you can see we clicked on anger management. I could also type in what I was looking for instead of using the green navigation menu. And I just started typing in anger management, and you can see that tag populated right here. So this is the symbol for tag, and that means that the Find Help platform uses that in their taxonomy. They have tags for every service, every program in this site, and those are really helpful to lean into when trying to figure out what word to use or what to search for that relate to what you're looking for. So instead of if I had come up with something else related to anger management, anger counseling, that might not be as effective as leaning into the tag that the programs would be tagged with. So I can click on that and it's going to pull in the search results. So you can see there were 6 programs that came up. You can see that where the zip code is that you used in the search. And the search results are going to take a few things into consideration. Right now, right now we're sorting by relevance, and that's the default. Whenever you do a search, it's always going to be sorted by relevance. And that is going to tell the algorithm that Find Help uses in these search results for all the programs that come up in the search, the ones that come to the top are going to be most relevant to the keyword or the tag that you used. So anger management is the tag that we used in this situation. How well that relates to the program, the title, the name of the programs, what's in the program description and the words used there, the tags. The algorithm is also going to consider the zip code that we used. It's always going to have some level of proximity and be taking into account the zip code that was used in the search. So this is an important note for those of you who have you work for an organization, you might have programs and services listed here in the Find Help platform. To help your program come up in search results, you want to make sure that you're using words that are words that anybody might be using when searching for things. We have professionals searching for things on this platform. We also have people in our community using this platform. So what are the basic words that you should be using in your program descriptions, making sure that you are tagging your program with the appropriate service tags and the people you're serving tags. The other things that help programs rise up in search results and that the algorithm takes into account are, was this program claimed? For those of you that don't know what that means someone from the organization verified that they work for that organization. They claimed the listing. You can see Gondara Center claimed this program. We don't know who it was, but I know it was claimed, and that they have the ability to update information on this program, which is ideal because the organization holds the most up-to-date information about these services. So that will help your program rise up in search results as well. The Other things that it will take into consideration are how broadly this program serves people. So this is a pretty specific search with anger management. There's not going to be a ton of programs specific to that, but this one serves adults, so that's pretty broad. It does serve people who identify as male. And so the most broad tag that you can have on a program card is you served anyone in need. So programs that are going to serve a broader community of people will rise up in search results rather than being very specific. Okay, so a question just came in that I'm going to answer really quickly around how to add your program to the site. There are many ways to do that, and we can follow up when we send out this recording. We can follow up with some useful links to that as well. But you can do that on our homepage, 413cares.org. There is a link to suggest a program, and you would then go through the prompts to do that there. Anytime you are in this part of the platform, kind of the inside of our platform where it's the Find Help setup, at the bottom, you can start to add a program by clicking the Suggest Program here. So a couple other things I want to talk about with making sure you come up with the search results that are going to be most helpful for you. You have some personal filters and program filters that you can apply to your search results. So the filters that show here are going to show based on the search results for these anger management programs that are coming up. So if you did a search for something different, you might see some changes in the filter options here because it's going to be dynamic based on the search results for that you have. But maybe I want to narrow by age. Maybe this is anger management for young adults, or maybe by gender identity or by income level. So you can use these filters as needed. I will say I wouldn't start by using filters. I think it's helpful to start broadly, and then begin to narrow and use some of these tools to help you narrow as needed. The program filters are a little bit different. These are based on the open hours, the cost, the languages that the program communicates in. I don't tend to use these quite as often because it just doesn't, like we usually, I think, get what we need from searching the way I've done it now or using personal filters. You can also add income eligibility to your search as well if you needed to narrow further. All the programs that are going to be listed in this platform are free and reduced cost. There might be a couple exceptions to that, but that is the eligibility that Find Help has to have programs on their platform. The last thing I want to call out is changing, instead of sorting by relevance, you can also sort by closest. And that can be helpful especially if you're in more of the rural settings in Western Mass. So for those of you in Berkshire County or up in Franklin County, you might do a search and there might be search results that are based in Springfield because they technically serve that area. Or, they could serve someone who lives up in Bernardston or in North Adams or Great Barrington. And that sometimes is helpful and then sometimes it's not. So if you switch your sort by to closest, the algorithm changes a little bit and you will have the programs that are closest to your zip code rise to the top. And that can be helpful in those rural areas. I would recommend trying that and playing around with that when you do your searches. The other thing that a quick tip, thinking about like how the location matters in the search results here between the two different toggles of relevance and closest. When you are setting up a program on the platform, or maybe you're going to claim your program on the platform, every program card, which is what we see right here, is going to have a designated coverage area. So if I click down, the coverage area for this Caring Health Center program is Springfield. It's really important that that is accurate. Sometimes when programs are added to this platform, Find Help puts in the coverage area based on the information they either get from the program or that they find online. But if that needs to be changed, that's a change that needs to be requested to Find Help or to us, and we can support you with that. It's not something you can't change your coverage area. It's one of the two things you can't edit when you're going in to change any information on your program here. But it's also really important that that's accurate because it will impact how your program comes up in search results. So I hope that was helpful in going through some of the details of searching and what to think about, whether you use this top navigation bar to find what you need, whether you're typing in your own word, and then how you can start to narrow from there. So I'm now, I'm sorry, I am going to say one more thing. And this was a tip that I shared out recently with someone and forgot how helpful it is. So as you can see, the program or the search is based on a zip code, right? That's the first thing we put in, or if I needed to change my zip code, I can start to change, I can change it by typing it in here. But if you're helping somebody, you might not know exactly, you can't remember every zip code in Western Mass. So you can actually type in a town. You have to put the state because Find Help lists programs across the country and Puerto Rico. So we have to designate the state. But usually when I do that, it will change. Oops, it didn't work that time. Let me try. So it's a little finicky, but this does work sometimes. And I want to share that with you because there you could see it worked for Williamsburg. I did not know the zip code of Williamsburg. Now I do, but you can play around with that if you're not wanting to do a quick Google of what the zip code is for the location you're looking for. You can type in the town with the state abbreviation, and it will switch over in a lot of cases to the zip code you're trying to search in. And now maybe I'm trying to find housing in around Williamsburg or resources for that. So now I can start my search in Williamsburg. So with that, I'm going to turn it back over to Francheska to talk through a few other features of the platform.
Yeah, thanks, Ilana. So the last thing Lavana talked about was the search bar where you could put in the zip code or the town name as the tip she gave. But right under it, this is a way you can translate the platform. So there's a select language toggle. It's currently in English, but if you would press it, there are over hundreds of languages that the Find Help platform can be translated to. So if I want to put it into Spanish or Korean or whatever language it may be, this whole platform would be translated into such. On the Find Help platform, another way, well, actually, we can go to the homepage. So the 413Cares.org, the original homepage where we started initially, can also be translated into various languages. It is in the top right corner, and Lavana's going through it now, where she can change it into another language as well. So this is a way where both the 413Cares homepage, but also when we do a search and we're on that Find Help platform, either page can always be translated to various languages. If you are sharing a program with somebody, Lavana, I don't know if you want to do like a quick search on a random program. Another way you can use this another translation feature is if I'm working with a Russian individual. I myself do not speak Russian, but I know that maybe online therapy is of interest and I want to send this program out to them. I can share this program with them in their native language. So I can write, hey, I know you were looking for some counseling services, some therapy services. I can write my message and designate the language to be in Russian or in any language that I'm helping somebody with. And it can be sent to them in that language. So they will get my message in Russian, but also the program will show up to them in that language. So this can be a very helpful tool if you are in a helper situation with an individual that speaks a different language. You can send this through an email, through a text, or share on Facebook with them. Looking at this, so Lavana's on a program card and she just used the share button. There are other features on here that you can access. So first of all, to be searching and using 413Cares and find help, you do not need an account. You can access several free tools through this, including the share button. You can make suggestions if maybe the telephone number is incorrect or the location has changed. You can always make a suggestion. You don't need an account to do this. One thing we do want for you to make an account for is if you want to do the saved favorite folders that Lavana talked about earlier on in the presentation. So if you want to create a folder of all the therapy programs in your area, or if I want to make the folder titled by the Russian individual I'm helping, I can create a folder in their name, save it, and just be adding to that folder. And so this is something you would need and to make an account for, which is just free. All I would need is an email and a phone number and a password. And lastly, the notes feature there is just that. It's just a personal note that you can make for yourself about this program. For example, if I knew a better contact number or I referred so many people to this program and this program is great, I could make that note to myself and save it. It is a personal note. No one would have access to it unless you want to share it with a team or anyone else that you designate through the platform. So just want to highlight that some features are completely free for everyone. Well, all features are free for everyone, but you don't need an account to access. But things such as the save feature and the notes feature, you would need an account for just because it can be personalized to you. Lastly, that last big teal button you see on any program card is really how you connect. And that was in my spiel in the video I showed earlier, but that is how you connect with the program. And it can look differently. It can say contact, it can say refer, next steps. And that's how organizations can know about whether you need the service or if someone you're helping needs the service. So Lavana right now is clicking on the referral button, and here you can actually, this program by Gandhara is accepting referrals. So you can refer someone else, make sure you have their consent to do so, and you would submit the referral and Gandhara would get that information. One of the best features about this platform is that we do bidirectional referrals. So what this means is that if I were to refer Lavana to this program, she would get notified that I referred her. I would obviously get notified that I did it. And of course, the program would get notified that Lavana's referred to. At any moment, if her referral is denied, accepted, she got the help, or she didn't meet the eligibility requirements, and that status was changed, we would all be notified as well. So this really closes that gap of, I sent a referral, what happened to it? So that is one of the neat features of having programs that have set up a referral. And that's what this looks like.
Thanks, Francheska. So I want to talk about a couple final things. And since Francheska was just mentioning how to submit a referral, I want to just show you really quickly what that looks like on the back end. So if you're a program that decided to turn on that referral feature for one of your programs or all of your programs, how you would get referrals for that. So when you have an account and you claim a program, you have program tools where you can manage your inbound referrals. Here you have other options around editing your program listings, which we're not going to get into today unless we have time in the Q&A. You can set up a team, so invite other staff at your organization to claim a program and have access to information about the program, and then program analytics. But in your inbound referrals, this is where you would see all the people that have been referred to your programs. You might have multiple programs, each one listed here and having its own referral dashboard. This is a demo program that we have set up to demonstrate this. So you can see someone has referred me before to this program. Or here we see I've referred my colleague, Bianca Twiggs. And you can view any screener that came along with that referral. Can be set up by the program. If I wanted to gather more information about somebody, I can set up a form to get that information to come through with the referral. I can update their information, their status of the referral. You can click on each person. So each referral or each person is going to have a little profile that you can add information to if that's helpful. You can share more information about who's in their household. You can look at all the details of the referrals that have been made for that person, add notes that might be helpful for you. So this gets a little in-depth and can offer some kind of case management support for each of the people that you might have been referred to your program. Alternatively, I can track the people I have referred to other programs. So if I've referred folks, it's going to be in the people I'm helping section, and every person I have helped here and used in our demonstration purposes is going to have a similar profile to what I just showed you, where I can add goals for that person, more of their information, their household, any key documents I want to hold in this profile for them. One thing that is helpful is I'm going to go back to the inbound referrals. So this is the program that I had set up. Some of you might, the type of information tracking that you can do for the referrals you're receiving here might be helpful for some of you if you don't already have a system in place. So people, you can get referrals from folks like how we showed you. You can also, if you wanted to, let's say you had some internal referrals, you had a colleague or someone in intake that someone walked through your doors and there was an intake process done and a form was filled out or whatever, and you wanted to add it to this dashboard, you can add a referral that way. I like to call this an internal referral, or the system says inbound referral. So you can add in that information yourself right here in your dashboard, and then that would show up here. So that can be helpful. The last thing I want to share is about favorites folders and just showing you a bit of the back end of that. So sorry, I have to get to the right tab, and Zoom is in my way. There we go. So what's really nice about setting up favorites folders is it's not only a tool for you to put together certain lists of services that are helpful for what you do in helping folks. It's an easy way to share information. So we often get asked, or the need for having printed like resource guides to give people, that some people just need that. I know folks that work with older adults, maybe they're not going to just hop online and easily navigate this platform. Maybe giving them a hard copy of a list of resources could be helpful. And so you could set up favorites folders in that way. And then I'll just open this crisis center and hotlines list we have created. It's going to take a minute to load. And while it loads, I have generated unique links for all of our shared favorites folders because we use them in a lot of ways. like you saw on our mental health page in that counseling favorites folder I showed you. So this link is a public link you can share out. It does not provide access for people to edit or change the list. It just gives them a clear view of the list that you've made online. So that's really helpful to share out with people you might be serving or as a way for your organization to use. But I can also, if once I'm in this favorites folder that you see now, I can share this. I can email it. Here you can see that's the link I generated to share publicly. You can also print it and have a print view of it. It's not going to have lots of colors and pictures, but it has the information laid out more cleanly. So that's a really nice tool for you to use in the work that is being done. You can also, anytime you're in a list of services, you can click on, maybe you just want a few of these, or these are the ones from search results that made sense for what you're looking for. You can do a quick print of those, or you can email it or start to save them into a favorites folder. So there's a lot of versatility here in how you can save information and share information. So I hope that was helpful for you all. So now we have about 15 minutes, which is great for questions, because I know people are going to have questions. So I'm really bad at keeping track of the chat and also talking and presenting at the same time. I'm going to lean on my colleagues that are helping with the webinar to help direct us questions. But Francheska, while I kind of go through, I think what some of the questions that have been submitted, maybe you want to answer a couple that we know already came in.
Yeah, so first I'm going to address the chat from the beginning. The recording for this webinar and the slides will be sent out after, so everyone will have this if you can't remember everything that we both went through for today. So you will get the recording and slides after, and you can share this out publicly anywhere. We would love that. There was a question in the chat about how long 413Cares has been up, and 413Cares launched in late 2019, so right before the COVID pandemic. But really, it came out of the need for having a community resource base database where people need to access these services and know where to go and how to get the help they need. So we launched publicly 2019 into 2020. Another question, I'm scrolling to the chat, but there was one that was answered, but just want to say, if you go through our Find Help platform, 413Cares, and there's a program that is not listed that you would like to suggest, there is a suggest a program links at the bottom of every Find Help page. I don't know if Lavana wants to share screen and show that quickly right now, but also on our homepage, on our headers, we have links to also directly suggest a program. And while Lavana gets that up, we will show. So from our homepage on the top right corner, there's a suggest a program link. And when you click that, you submit any information you know about the program that you may know of. As well, there's also a link to claim a program. So if there's a program, if you work for an organization that has their service and program on here, you can go through the claiming process as well. So just want to highlight that's where you can find it, but also on the Find Help platform, you can also scroll all the way down and find the link there as well. Another question we've received that maybe Lavana can kind of talk a little bit more about, but is finding housing is one of the biggest challenges. The waiting lists are long, even most shelters are full. Are there any agency that pays for hotel stays?
That's going to be hard to answer. Housing is really tough right now. We're in a housing crisis. So the waiting lists are real. So if you wanted to, if we searched, I'm just going to go back to Springfield and put in the zip code. If you wanted to search for, maybe we want to do like help pay for, let me see, let me find the right tag. If in housing, help pay for housing. And maybe it's specific, like maybe we want to get housing vouchers. So you can go through and see if any of the organizations here can help with that. Wayfinders for sure. They're also listed on our housing page. Any of the information centers, the housing information centers that have their own regional coverage. So Wayfinders for Hampton and Hampshire, Franklin County Regional Housing and Development Authority, and then Hearthway and Upside 413 in the Berkshires. So I would lean on these. I know it's really hard out there, so I don't have a great resource off the top of mind that can help with that. But if folks that are on the webinar do, feel free to put stuff in the chat. That might be helpful. There's a question around, so a couple things I want to answer because there's a lot of great questions that are coming in and some that have been submitted with registration. So first, I want to just call out that we have a whole section of our website for organizations. So if you click on that for organizations, it's going to bring you here. There's quick links for you. We have a tutorials and guides page. There's also, you can get our search widget. So if you wanted to add our search box to your website to just have as an additional resource for people, a lot of libraries do this, or it's great. Like people are coming in using public computers on those libraries. We've had some libraries add information about 413Cares to the computers, adding our search widget to their websites. So you can click on that and get we have the code right here for you to add, or we can work with your organization to figure that out. So that's a really great resource to make it easier for folks that are coming to you or coming in your space and maybe accessing computers for them to have 413Cares here. I know Western New England University and their School for Social Justice at the law school, they have a legal kiosk initiative. Some of you might know about that. They have 413Cares there on those computers. So when people are going to the kiosks, maybe they're going to be Zooming with their lawyer, but they might also need other services. They can start searching on 413Cares right there. Can people self-refer to a program or agency? So yes. Let's go with Wayfinders right here. They have a referral set up. So if I click refer, I can click on referring myself and then put in my information and send that to this Wayfinders program. So you can self-refer. You do not have to be working with a client and just referring clients. Let me just look at some other questions that we've had. We also, so if you are thinking that it'd be great for people in your organization or community members that are walking through your doors to know about 413Cares, we have tons of printed materials we can provide for you. You can reach out to Francheska or I to request anything if you wanted to have some tip cards in your area where that's getting traffic, high traffic of folks. We can also do presentations and trainings, not only for community members to learn about this platform, but we do this all the time for organizations, for teams of helping professionals to learn about how they can use this as a tool in their work and or how to claim your program and edit the program listings or access the data. I think there was a question around referral data and exporting of data. I'm not going to get into that. That would be a whole separate webinar. You have your referral dashboard here, but you also have all these program analytics and a number of different dashboards here that would show you about the people that have been referred to your program, screening data, if you had set up an intake or a screening form, any data that comes through with that. So this is a whole separate topic, but it's all in your program analytics. If you have claimed a program, you have access to that. I will suggest that if you are thinking or wondering about if you should claim your program, I would suggest you talk with your organization first and decide who are the right people to claim programs. If people don't know who kind of is taking that on, it can become in the sense of too many cooks in the kitchen. And if maybe someone updated information and then someone else goes in and changes it, it just gets a little uncoordinated. And so I really suggest there be some decision making in the organization on who are those roles to claim programs. And we're happy to talk through that with you and your organization as well and offer any suggestions. And you can also set up teams of folks. And so we're happy to talk individually with organizations that just want to get a little bit more in depth on that. So someone asked, how does 413Cares and Find Help differ from Google search? Google search is gonna pull in a lot. Sometimes that's helpful, and sometimes there is even more noise in what Google is pulling in. And so this is going to be really specific to the zip code you use and the keyword or tag that you're searching for, and not pull in all the noise from the Google universe, or how their algorithm works and why some programs show up in their algorithm. I'm not saying Google can't be helpful, but this is much more concentrated and less based on advertising and other things, and how search results get shown. Okay. I'm just reading. What is your relationship with Find Help, and is one site more effective than the other? If so, then what makes one more effective? So there's, in a sense, no wrong door. 413Cares, once you start doing a search, you are in the same Find Help platform as if you went to findhelp.org and started searching directly on their platform. So we link right into their platform. So it's just one of the doors into Find Help. A lot of healthcare agencies are using Find Help, and they might have their own license because they're tracking their patient data. That allows them to track their patient data, but it's all leading to the same platform. The only difference is that we have made our own resource pages specific to Western Mass. That's not getting yet into the search and the Find Help platform. So if you think one of these resource pages could help you narrow into what you're looking for, start there. And then if it's not leading to what you're finding, try a search. But we are trying to make 413Cares responsive to community needs of Western Mass. We're one of the few partners with Find Help that we built our platform purely for the community to use. We don't track any patient data or client data. We can't see that. We're trying to build our platform to be responsive to the needs of our communities around Western Massachusetts. So going through 413cares.org and starting your search that way, we do see what people are searching for, and that can be really interesting and helpful. So you can see every month we're posting what people were looking for the previous month. And this is pretty consistent month to month, but it's helpful to get a pulse on what is the need in our communities. And we can even do searches specifically for counties or by zip code. So it's interesting to see and helpful for us to keep tabs on what the needs are of the platform. So I'm gonna wrap up, but just know that if you have additional questions, if you run into any obstacles using this platform, if you want any materials, if you could use a presentation or a training, please reach out to Francheska or I. We'll put our contact information in the chat. And so these are the ways we can support you. Let us know. We are also, there's a lot changing on the federal level right now with this administration. The impact on our local services is going to be changing. There's a lot in flux, it feels right now. Feel free to let us know and help us. Let us know if we should make changes based on maybe program availability becoming more limited because funding was cut, or a new program or mutual aid is popping up to be responsive. So it's really helpful for you all to feel free, like you can reach out to us and make this a collaborative platform where we can be updating information. Find Help is not just a platform with a bunch of techie people. Francheska, if you want to go to the next slide, they also provide a lot of support, and we can always bring them in to provide even higher level technical assistance as needed. So there is a support portal for community-based organizations that you can access. We'll send the link to that with this recording via email. You can also contact their help desk with any sort of questions or technical issues. It's really helpful for us to know if you're running into that, but we might bring in Find Help if we can't answer it. So you can contact them directly as well. They have monthly CBO trainings. So those are another option to learn how to use the platform. And we can get you information about those. So with that, here's our contact information, and we are grateful for all of you for being here. If you are able to, we do have some state funding that we've received, but we are trying to get state funding funded in the budget for next year. So feel free to call your representative and ask them to support the budget amendment for 413Cares. We're trying to constantly make this a better platform and continue to grow and develop it. So that support is really helpful, and we're grateful for that. And here's the link to the survey. It's a very quick survey. Just tell us how we did, if this was helpful, what else we could do for next time. So thank you all for being here, and I hope you have a great rest of your Friday. Take care, everyone.
Thank you, everyone.